While some hospitals in southwestern Ontario are easing their COVID-19 masking policies, many Toronto hospitals are keeping them for the time being. University Health Network and Unity Health Toronto will continue to require masks in all areas where patients may be present. Sunnybrook Health Sciences Centre still requires masking for patients and visitors, but is relaxing universal masking for staff-only areas. And starting on April 24th, masks will not be required at sick kids in non-clinical and non-patient-facing areas of the hospital. And for more on how each nuanced approach could cause some confusion, I'm joined by Dr. Farhad Razak, internal medicine physician at St. Mike's Hospital. Doctor, thank you for your time. So let's just jump right in. What do you make of most Toronto hospitals keeping most masking rules in place, while hospitals in other parts of Ontario, perhaps with smaller populations, they're deciding to do without?
Yeah, I like that the Toronto hospitals have taken a coordinated approach to this. You can clearly see that there was some discussions behind the scenes to say what is a reasonable approach where we can first, most importantly, prioritize the safety of our patients. And remember, in our hospitals in Toronto, I'm a physician at Unity Health, St. Michael's Hospital. You see some of the most vulnerable people in society, people who have cancer, who are immunosuppressed, who are there after a heart attack or after a car accident. These are people who are very susceptible to additional illnesses, and where the consequence of that illness can be quite significant. And you're seeing a pretty strong position across these hospitals to say, whenever you're within the vicinity of these patients, you have to continue to use a mask to protect them. And I think that is appropriate and does also reflect the fact that there is still a lot of COVID transmission happening in communities right now. Now, for most of us, that may not be that significant. But again, for people in hospital who are vulnerable and susceptible to these infections, it could matter a lot.
And what's your take on the fact that there's really no big central guidance coming out from, let's say, the government? When we take a look back to the initial point of this pandemic, when there were more clear-cut general guidelines, and now it seems as if we're seeing that each department, each hospital, each region is kind of making their own call on this decision.
Yeah, I'd like to see it more centralized, and it's for a couple of reasons. So I can tell you as a healthcare worker, one of the things that's very difficult for us is the patient or the family member who does not want to follow some of the rules that we have for protection, things like masking. It can lead to very difficult situations. And one of the things that made it easier for us earlier in the pandemic was the fact that there was a uniform policy across hospitals. And so we can say this is a central policy. This is set by government. This is set by public health leadership. It applies to everyone. When you start to get that spread between hospitals, it allows the more difficult and argumentative situations to arise, which, frankly, is not what we're trained to do. And it can lead to difficult circumstances, which I think all of us have seen on the front lines over the last couple of years. The other reason why a single policy I think is important is that sometimes these decisions are actually quite tricky, and the central resource of Public Health Ontario, the Chief Medical Officer of Health, they have the resources and the expertise, I think, to really interpret the numbers and set policy across the province. And it can make it easier for smaller institutions, which sometimes don't have that expertise, to have one point of advice that they can follow to make these big decisions.
Do you think that this is going to create confusion, though, for some people, or perhaps even a lack of trust, public trust?
I think it will lead to some confusion for people, and I think it will rightfully lead to some parts of the public asking, if I don't have to do it at one institution, why do I have to do it at another? I hope that's a minimal part of the decision-making. We're clearly at a phase now where there is some pulling back of public health measures, already, of course, largely in society, but now within healthcare institutions. I hope that as it's done, we can start to cleanly message and clearly message to people, look, we're going through this transition right now. There's going to be some inconsistencies in the process. We're a big province, so there's going to be some inconsistencies. But hopefully behind the scenes, there's going to be continuous monitoring of data. And if we do start to see some uptick, more cases within vulnerable patients, for example, or even healthcare workers being affected, which is impacting staffing levels, that there's an ability to pull back on this policy and go back to some of the stricter protocols, which we know are there in place. They're not pleasant for everyone. No one loves wearing a mask, but they're there because they were a necessary part of protecting patients and keeping the system operating.
Yeah, it certainly is a work in progress, as you noted, considering just how large our province is and how many different regions there are. We do have to leave it there, but Dr. Farhad Razak, thank you for your time this evening and for breaking that down for us. We appreciate it.
Nice to be on as always. Thanks.